Hey everyone, welcome back to the Backyard Horse Enthusiast, where we dive into the world of horses and the incredible people who are making a difference. Today, I am thrilled to introduce you to a true pioneer in holistic equine wellness, April Love, the founder of Holistic Horseworks LLC. April has spent decades developing revolutionary healing techniques that empower horse owners to take their horse's health into their own hands. Through her IICT approved methodologies, she's helping equestrians around the world address the root causes of pain and imbalance, keeping horses happy, healthy, and rideable well into their 30s while saving thousands of dollars in vet bills. In this interview, April is going to share her expertise on equine musculoskeletal unwinding, craniosacral unwinding, advanced applied kinesiology, and more. If you've ever wondered how you can help your horse feel better, move better, and live longer, this is an interview you won't want to miss. But before we dive in, I'd love for you to take a quick moment to hit that subscribe button. Give this video a like and leave a comment below. If you find this conversation helpful, we'd really appreciate it because your support helps me to continue bringing you expert equine content, and I'd love to hear your thoughts. Now let's jump in and learn from April Love how you can become your horse's best healer. Let's go.
Coming soon, Holistic Horseworks Remedies.
Take the guesswork out of your horse's health. What would you do if your horse is limping, colicking, tripping, spooking? Created for horse owners who want to troubleshoot, learn, and take action right from your pocket to your fingertips. This app is designed for the horse person on the go who needs answers fast. Figure out what is really going on with your horse. Find natural remedies that work. Explore expert solutions to common horse health issues.
Holistic Horseworks Remedies. Coming soon to Google Play and the App Store.
Hey, April, welcome to the Backyard Horse Enthusiast. We are so honored to have you here today to share your holistic horse care approach with the rest of the world here, as you've been doing. So we're really excited. Thank you.
Thank you, Kimberly, for having me. I'm excited to be here.
And with that being said, I'm going to go ahead and dive right into the questions that I have for you, April. And I'm going to start with your approach to equine wellness. It's incredibly unique. What led you down the path of discovering and releasing deep skeletal and muscular issues in horses? Where did that begin for you?
So ever since I was little, I've always had the passion about horses. Every school I went to, read every horse book. I was lucky that my grandma gave me lessons in horseback riding when I was in 5th and 6th grade. I just lived and breathed horses. But that's a childhood thing. And I was always bareback, without saddles, watching horse movies. And then you kind of grow out of that. Like when I was 17, they had horses for us to ride on the weekends up in Santa Rosa. We drive from San Francisco up there, and there was only 3 horses, and you wanted to go ride. Otherwise, grandma and grandpa gave you chores. So it didn't matter if the horse was limping or coughing or only had 3 shoes. The grandkids wanted to leave, or you got to go do weed whacking and chores. And so it's kind of I'm so sorry for those horses. They would see us run. We'd come up with 50 pounds of carrots and 50 pounds of sweet feed, just want to ride the heck out of them all weekend and then go. So no wonder why they ran away, right? And got back into it in my 30s. I had my midlife crisis early when I blew out my shoulders, and the doctor saying, stay home like this. And that horse passion was just coming up again. And, that wax on like Karate Kid and wax off, those were the exercises I was supposed to do for my shoulders. So I went and contacted a place. Can I come groom horses for free just to get around them again? I was just missing that in my 30s. Women come back to it, and did everything wrong, saddles, bridles, everything, and was introduced to one of my healers, Dr. Regan Golub, who started working on the horse. And I was doing 50-mile endurance riding at the time, and then team penning with my little Arab mare in the winter. And I was just happy doing 8.5, 9 hour 50s out in the desert with my horse. And he started working on my horse, and I was doing 50 miles in 4.5 to 5 hours. So I was like, well, that's much nicer to get done by, noon when it gets hot. And my horse just had really good vet scores. So then I wanted to learn how to do this, taking his courses and other courses. And when you're doing 50-mile endurance rides, you have to trot for the vet to see how your horse is at the beginning and at every vet check and at the end. And very frustrating when you get pulled for grade 1 or grade 2 lameness and the vets couldn't tell you where it is. Well, for $500, I can nerve block it and tell you what it's not. I'm like, well, that doesn't work for me. You're telling me to give my horse Butte, go home, give it a week off, and hope it gets better. And then you go to the next endurance ride and you get pulled at mile 25 again, and you're sitting there with your horse for 3 hours waiting for the horse trailer ride home. And just watching all the horses trotting out for the vet going grade 1 lame, grade 2 lame. Where is it starting? What's causing all this? So I just started taking all the bodywork courses because I was paying someone else to fix my horse once a month. And I was asking, how did my horse get this way? What is my homework? So I don't have to pay you to come back, And of course, I don't want to tell you. And they had all these big words and see you next month. Thank you for $500 for 4 horses. And so I was like, I need to learn this because I want to be able to keep my horse going. So I just kept taking a course and taking another course. And Regan's course was like $2,000 in Washington. And Maureen Rogers' cranial course was $1,000 each time down in Santa Cruz. So all that travel is involved and staying somewhere else and working on horses. And then my little white gelding, he was a Kentucky horse. He had so much heart. And I just wanted to make him better and ride him because I liked his mind. He just had such a great mind. He'd whinny at me. It was just so much fun to ride. And in each course I took, I was like, well, but you're missing this. So in cranial sacral, they don't get into the body work, and the atlas and axis is out of alignment. So you don't even have any energy coming through the dural tube to the hind end. So why would you be working on the head when the body's crooked? Or the body workers that work on the body and they don't even pick up the hoof to see that the frog's off center or the hoof's out of shape. So no program was looking at the whole horse, the emotions, the acupressure, the skeletal, the cranial. So I was like, okay, I guess I get to take another course. $19,000 later, I would just bring it all back to Tiki and see what he liked in what order. So he's the one who helped me develop the program through kinesiology. So you don't want this before I do this, and you want this, and what can I do in the middle of an endurance ride to keep him going? We did all 4 days of Death Valley, 50 miles a day up to like 9,000 feet and back down in the middle of winter. And there's no horse trailer coming to get you if your horse goes lame. And they took your rig and moved it to the next camp. So you better be able to make it to the next camp. Yeah. So it was just learning all those little things and doing them more often, where people would just do body work like before the ride and a couple of days after the ride instead of during the ride. If you had a human that was they have the 100-mile Tevis race in Auburn, California, and the month before they have a human one. And at their stops, they have massages going. People are rubbing their feet. They're doing their muscles. Why are we not doing that for our horses, who is an equine athlete? You get anaerobic, you slip, you do a strain, and it's going to tighten up later. So we were talking about what, got me into all of this was my Arabian gelding Tiki, and keep taking courses for him on, the legs and the whole body and the head. And because we were doing the 50-mile endurance ride. So when I put this program together with each class, I take it back, see what he liked, what he wanted, in what order. Then we did 41 consecutive completions of 50 miles or more in a day with no vet pulls. And at the time, I was 50 pounds heavier. So I was in the heavyweight division. My little 14-3 Arab was carrying 215 pounds with tack. There was carrots, and I actually had a little water bottle on the saddle when we're climbing hills. He'd turn around, I'd squirt water in his mouth. So he's the one that I developed the whole program for. And then people just kept saying, "Oh, would you work on my horse? And would you work on my horse?" And I'm like, "Well, yeah, your horse is crooked. Look at the four hooves. They don't match." "Well, how do you see that?" My farrier didn't say anything. So
Huh.
it's just putting all that together, but being able to explain it in a way that the backyard pet owner, your four hooves don't match, so your chiropractic adjustment's not going to hold. It's like you standing on a low heel and a high heel all day long. Your whole body's going to shift.
Are the hooves changing because of skeletal and, musculature, these things being off as well? Or is it is it the chicken first and then the egg, or the egg and then the chicken? How does
Well,
that
your
work?
farrier trimmers will tell you, they can change how the horse moves, but it's not in a correct way. So, how the horse loads and stands on the hoof 24 hours a day is what grows the hoof. If they have
Mm-hmm.
tight sternum and pectorals on the front hooves, they're going to be jamming from the inside and pushing to the outside. So, on that front hoof, you're going to have a straight hoof wall on the inside and medial flares on the outside, and no one will
Mm.
explain that. So I chase it higher up in the body, compressed heel, or low heel and long toes is a horse whose lumbar is in spasm, probably with roachback and hunter's bump. And they're trying to stand way over the front end to traction the lower back. But our
Mm.
response is to cut off the long toes and to wedge them up. So here they're trying to traction their back and they no longer have that toe to kind of brace on. So I've
Oh.
seen them put them on egg bar shoes. The frog's not getting any support, your heart pump. And I tell
Mm-hmm.
everybody, put your horse in the cross ties or in the barn aisle, go about 10 feet behind and squat down and look at all their hooves from the rear.
Mm-hmm.
So the farrier trimmer can shape the front to make them look nice, but the rear is going to show you how that hoof is actually growing.
Mm-hmm.
If you're having issues on string halt, that's that locking stifle, equine shivers, it's always in the right hind leg because the right hip's always back and tilted. And you'll see an inside compressed heel with the toe shooting out. So if the hoof is this way and the hip is up here and they're not loading, the knee is taking all the stress in the middle. So you need to look at how the hoof is hitting the ground, where the hip is for the stifle to be able to get better in the middle. So the
Mm.
high-low syndrome is usually on the side with the first rib out. So we found foals as early as 3 months of age just from tumbling or, being in the stall giving birth, and that first rib is already misaligned. Well, that's going to be the foot that they put back when they graze because the shoulder can't come through freely with the first rib. I actually have, you might put it up later but this was a skeleton of the first rib, and I can kind of point out, and then one hoof is bigger. It's not that it hurts the horse, but it doesn't allow the shoulder to come through freely in a forward movement.
Sure.
So that foal will always have that leg back and the other one forward. And in that position with his head down, he's compressing the left front heel and the right heel is back without pressure on it. So that's going to be your high hoof. And the one always going forward is going to be your low hoof. So until you change how that foal eats off the ground, you're not going to change the high-low syndrome.
Oh my gosh.
One of my best clients who's done Tevis and top 10 and everything in endurance rides, she got in a horse for a pretty good price, really good endurance bloodlines because he had high-low syndrome. So they sold him. And then he's top 10ing and getting best condition awards. And they're like, "Hey, that's a really good horse." "Oh, that's the one we sold to you. Where's the high low?" "No, April worked on him. Both feet are the same now." So all these things, kissing spine is just muscles pulling bones too close together. And people say, oh, I don't want to breed that horse because it has kissing spine. But that's just both first ribs are misaligned, neither shoulder can move. So the muscles are pulling the bones too close together. It's not genetic deficient that you don't want to breed that mare.
Mm-hmm. Makes sense. Oh my gosh. Oh, and the fact that these foals at such a young age are, I almost feel like they're misunderstood, oh my gosh.
Absolutely. I've been called out to work on foals. The lady, they were all handled nicely. She sent the mares with the foals to be bred at this breeding farm, and they all came back terrible messes because they probably tied them up or locked them off when they took the mare to do live cover, and you couldn't get your hands on them. They were spinning and kicking at you. So we're out there for 3 hours. I actually have a video on how to work on foals, how my program's different on babies. And the next day she's like, oh my God, they just come up and put their head in the halter again. And they're so happy to work with people instead of fighting and doing all these things. And one of the worst tragedies we're doing right now is the knotted rope halters on horses with the natural horsemanship.
Mm-hmm.
So 25 years ago, when we were young doing horses, the flat web halter, the little cheap snap, when the horse spooked or pulled back, something broke and less damage was done to the horse. So now they put them on the patient's poles, and that's cliff climbing rope. And it slides up and it catches on the back of the occiput. I have a little skeleton here.
Mm-hmm.
So when the horse is pulling back, it slides up, it catches there, and it shoves the occiput down into the head because the horse is in this fight or flight when they're pulling. And it does a lot of cranial. So we're having more uveitis, autoimmune, Cushing, because the pituitary is all stress and the hypothalamus, which is under the brain, which has just been smushed. So if you look back, we have more Cushing, more all of that when everybody kind of switched over to the knotted rope halters. So I'm not an advocate of those. It's a great training tool. They do the knots because, here's all the nerves coming out on each side, and the knots are supposed to sit on that. So you're actually sitting knots on cranial nerves, which isn't very good either to control the horse.
Pain,
So
pain,
yeah, my
pain.
level 3 is all about we actually manually move the bones and cranial decompression and bring it back up. And we've gotten a lot of horses off the autoimmune and the Cushing medications just by kind of monitoring a little bit better with cranial and body work.
Okay, you've really piqued my interest because my 21-year-old gelding last year was diagnosed. We did the two tests. We did the non-fasting, and then when it came back that it was early, then we did the fasting, and he's got early stage Cushing's. And I always have felt, even with having massage therapy, uh, chiropractic work on him, PEMF, like all these things done, I've always felt like there's just something still about going on, like with his pole and his, I don't know, I can't explain it, but it's a gut feeling. And now he's on Presend, and I'm like, I am not an advocate of just treat with stuff. You know what I mean? I really like the more holistic. His diet is forage based with, he gets the sprout pellets and the Saint Foin pellets and constant access and slow feed hay nets, around the paddock and that. And he's out 24/7. But I'm like, it kills me to have him on this Presend because I really feel like things like that end up creating other stuff down the line, right? And that there has to be a more holistic way to treat this and oh my gosh, April, what am I going to do?
He's got to come to a level 3 class. So if you're having autoimmune issues and Cushing on your horse, you miss some early signs of a little bit of thin hoof and crumbly hoof walls because that's the liver being stressed. And after winter, there's some long hairs that just don't kind of shade out as fast as all the other ones. And
Hmm.
up in the mane, getting a little bit thicker and crustier because they're storing the toxins up in there. So everybody's kind of missing this. Your horse is just getting older, is what they're thinking. But
Mm.
if you Google Cushing, tumor on the pituitary, and where is all of this in the hypothalamus, it's right under their brain. So when that organ is right there and they pulled back so hard, when you evaluate your horse and you put your hand straight up their forehead, you should feel two bones up here like two goat horns that want to grow out of the skin. They should be quite prominent. And
Okay.
with the horse, if you put the horse's head like this, you won't feel it. So the horse's head has to be down and then they actually come up. You'll feel one side lower and maybe shifted forward. The other thing you'll see is these are the up down chew muscles here. They're getting bigger because your TMJ joint is compressed and the horse can't chew sideways. So when a horse sits down to pull in fight or flight struggle and they can't get away in the new knotted rope halters, you'll see them usually hang to one side. So before they'd pull back, something gave. Less damage was done to the horse. That thin rope slides up and it really stresses a nuchal ligament attachment to the back of the occiput and it shoves this down into their head. They'll be reactive. But the other thing is if they're not chewing sideways and they're chewing up and down, you're getting the hooks and waves that needs the dental floating.
Mm-hmm.
So that's shortening their eating ears. You know, the heat and
Mm-hmm.
friction. I always tell people try and find an equine dentist that does individual teeth, not just a big long file.
Right.
When you look at their teeth, this is round,
Mm-hmm.
but some typical vets will just get in there with that big flat file. So they're
Mm-hmm.
taking teeth down short and then leaving the front and back ones longer, and that doesn't fit the jawbone of the horse.
Sure. Sure.
So then you're going to have digestion issues because they can't masticate their food.
Right.
And then you'll also see when you look at your horse like this, even on this skull that I bought off of eBay, which is a plaster mold, you know, you can see that like one cheekbone is lower. And if you look up at the
Mm.
eyes a little bit lower. So they actually did an impression in a mold on a crooked headed horse.
Mm.
So if you put your hand out in front of your horse, like you're giving them a treat, you know, so their head's down in your hand, look at their eyes, look at their cheekbone, and look at their nostril. You'll see one side's dropped.
Mm-hmm.
So to the trainers and the competitors, I'll say, so your horse is heavy on the left rein. And they're like, yeah, how'd you know? Well, you continually pulling on that bit to say give to the left rein is actually destabilizing the TMJ joint.
Mm-hmm.
It actually dropped a half inch to an inch. And I tell people to get a tape measure and measure from the pole to each lip line, and you'll find one side's lower. And until the horse does my level 3 class where we actually manually move it, try to get out of the mouth of the bit or find a bit where you can drop one side. All the resistance goes away in the horse.
Mm.
They're just saying, yeah, you're pulling on this side, but this side's locked. You know, especially in combined driving horses. You keep pulling on that left rein, it's going to throw stress back to the right hock because he's bracing through his body. The combined driving horses were really fun to work on. Everyone's like, wow, they can actually do the whole course now and they're soft and light and they can stay straight in the harness. And so I worked on just about every breed and every discipline. And 2011, I started being invited to teach internationally, so UK and Australia. And it was nice to see the horses all around the world on different feeds, but they all still had the same issues. First rib as a foal, you know, water and feed sources adding up. And the knotted rope halters got really popular. You put those on the young horses and you're going to have a lot of damage done up there. A 3-month-old foal just kind of rearing up and fighting like this on the handler is the same thing as a 14-year-old 1,400-pound horse pulling on the side of the trailer because the cranial bones are so soft. So
Mm.
most of the damage is done before we even get them into training. So that's why one of my videos is how to work on foals. If we can start working on them at 6 and 8 months, you're not going to have high-low. You're not going to have kissing spine. You're not going to have uveitis. The uveitis eye that they actually remove, it's just anything with an itis is inflammation. So then they put steroids in the eyes to take down the inflammation, and they give the horse owner a pointy metal tube. So the horse owner actually does more damage trying with the pointy metal tube, trying to get the anti-inflammatory medicine in. But the eye that they always say has uveitis is the one that's always dropped.
Mm.
So when that lacrimal bone is dropped and shifted, when we work the horse, it throbs, and they drop and rub that side of their head on their foreleg. How many horses have you ever ridden or worked that drop and rub their head?
Yep.
Pay attention. It's always on one side. That eye is bugging them. Well, where is the dirt and the fly spray? On the foreleg. So then they're rubbing the dirt and the fly spray, and that's what makes the pink-red inflammation on the inside of the eye that we are now treating with anti-inflammatory medicine. It's also the one that's always weepy. So we actually shift the lacrimal bone back up, detox the eye, and bring health and vitality back to the eye. And I've had 4 clients say, thank you. The vet said that he must have misdiagnosed uveitis because he no longer has to remove the eye. We're like, yes, score 1 for the home team.
Oh my
Saved an eyeball.
gosh. That's amazing. Now I keep going back to Dakota. Like he's got it in the summer, his left eye is the one that's problematic. It'll
Right. But
weep, sometimes it'll swell.
when the bone is jammed, when they're hot is when it's throbbing. If he trots a little bit, and you get hot, it's throbbing. So that's, and the fly mass, you have your eyelashes, and then you have the long ones that come out on top that are kind of
Yeah.
stiff.
Yeah.
You have to trim those if you're going to put on fly mask, because what happens is inside the fly mask, that long hair is coming back and poking them in the eye. And how many fly masks have you bought where they have a hole over the eye? They've been banging that eye all day long because their own lashes is bugging them, and they make a hole, and then you're like, okay, I got to buy another one. So I like the equivisors because they're kind of sewn with stiff,
Yeah.
so that the horse can't push it in. Equivisors came out mainly for like horses with surgery, but they have fly masks that can't be pulled off. I had 2 geldings, and he would always pull the fly mask off the other horse. So I had to have 7 fly masks so that once a week I'd walk the 2-acre pasture, picking them all up, washing them, putting them back on. And
There's
once I
always
got the
one.
equivisor, once I got the equivisor, it stayed on, and
I've
the
seen
older hide,
them.
yeah. So it's one of the brands I like. Anything that really compresses on here, when the horse is rubbing, you really got to make sure those eyelashes, if you take off the fly mask and you look sideways, you'll see these long things curling, and they'll be
Yes.
like little gooby stuff.
Yep.
So we just open the fly mask and throw the box away. Does anybody read where it might say maybe we should trim those?
Does that
No,
exist on those boxes? Because it
I've
should.
never read a box. I was
It
just like, I
should.
know how to put this on. Boom.
Right. I wonder, I'm going to have to look. I'm going to have to go into Tractor Supply and grab a mask off the shelf and just read the box, but it should say that. Oh
And
my
then I
gosh.
had a horse that was always getting his eye medicated. So the client's like, you'll never get near his eye to trim that. And so I actually have a video. I've got over 200 YouTube videos on all these things to do. I said, sure, you just come up backwards like this. And he didn't see you, and you put the lashes there, and she clipped. She's like, oh my God, we've been trying to get near that eye for a week, and it's all over. And you just came up and went, sure, it's just that easy. Well,
Oh
don't
my
let them
gosh.
see the medicine or the scissors. Just come backwards, hold your hand there very soothingly, and then do what you need to do, or put a drop in there. Don't be like, oh, yeah, here's some sharp pointing
Right.
scissors and medicine I want to put in your eye.
Makes perfect sense. Oh my gosh. I could end
So,
this interview right here just with what you've shared. I'm like, I have so many things that I need to think about, do, take care of. You said the level 3. Now I'll be reaching out to you when we're done with this because oh my gosh. It's all about my horse and my dog. That's all I have in my life, truly. I mean, I have friends and family, but they're my life. So,
So you don't even want to get me started on dogs. I figured out what starts hip dysplasia and how to fix it.
oh my gosh.
And I have a video on that. So on dogs, it's all neck related and collar related as a puppy before they're a year old. And with the dog's head down, if you go up behind their ears, you can find the wings of the atlas. It's a big bone with their
Yep.
head down. If so like if they have a collar on or a big dog grabs them around the neck when all the bones are so soft, that shifts. And the pattern is if the atlas drops to the left, the right hip comes forward. And if it drops to the right, the left hip comes forward. So in the hip dysplasia, I actually have a PowerPoint and an x-ray with it straight, and you can see each hip socket, the leg is able to do this. Well, on the hip dysplasia dog, the spine comes and it curves, right? So the psoas goes into spasm. It kind of pulls this hip joint from this to this. Now the top of that femur, that's the hip dysplasia. It's grinding away in there.
Hmm.
So it's making a bigger gap. But the other side is the ACL tear. The right hip can't do its job, so the left hind knee is doing more. So I make a lot of friends at the beach and the dog parks. And when you're petting your dog and you go over the rib cage and it raises before you get to the hips, that's the whole psoas and spasm. Dogs always want their butt rubs because their hips are out. Horses rubbing their butts on the fence isn't because of parasites, it's because their hips are out and they're trying to readjust their hips when they're like sitting on the fence and stuff.
Oh
So
my
I
God.
teach if we actually listen to them, and our animals can last a lot longer.
Yeah. Wow.
So, and I know you're going to put up some promotional stuff, but I really wanted to put out educational books that people grabbed, like Don't Squat with Your Spurs On. Remember that
I
funny
have
little
that
book?
over my toilet.
Right. So my first book, I found someone to do all these white, happy, fat horses, and the Horse 101 ebook is just how your horse gets crooked. All the things where Yvette said the trailer rolled, but yeah, your horse is fine. Your horse is not fine. He hung by his neck in the trailer,
Oh my gosh.
while it was upside down, all these things. So it's all these common sense things. And that's the free ebook that we give out people to educate them why they need my program.
Okay, and what I'm going to do is, folks, what you'll see is a little QR code hanging around April's head. Just scan that and you'll be able to get that.
Yeah, and that'll lead you into the education. And then everyone's like, so what do you do? So my second book, isn't he just so cute? You're going to throw away everything that is in your medicine chest. You're never going to use alcohol, iodine, hydrogen peroxide ever again on any wound, and you're not going to cold water, fresh hose a wound. We are
Mm,
saline bodies. They'll say, yeah, cold water hose that leg wound, right? You're going to have yellow pus, edema, and green goo coming out the next day because that's what happens when fresh garden water hose hits a saline body. So we hot pack it with tea tree oil and dynamite trace minerals, and the whole wound closes up. And the horse actually says, here, mommy, here's leg, fix. Instead of having that goopy mess that swells up, is hot, you're pulling off the bandage, it's painful to the horse, it's stuck to the horse, you're starting all over again. Where my way, you're like, oh my God, this costs $75 to heal a gash across my horse's shoulder that the vet couldn't stitch or something. So I'm all about easier, better ways for the body, for the cells to heal, and how to prevent colic and, all these other things, and, to shoe or not to shoe. I actually have a hoof soak that you want to do if you want to transition to barefoot. You can't take that shod horse and put them right down on the ground and expect them to still walk.
mm.
When they're sore, that frog is the heart pump. Every time this comes down, it signals take toxins out of the legs, but to grow. So you take shoes off a horse and they stand there all day because they're in so much pain. And you're like, well, there's nothing to trim or work on 4 weeks later because they're not stimulating that heart pump. So I have a hoof soak recipe that we use to get rid of white line, toughen up sole on those like crumbly hoof wall, thin sole thoroughbreds and some other horses. But we do that for 3 days before we pull the shoes off, and that sole and frog is ready to hit the ground and they can just walk out sound.
Wow.
So there's all these things, if we just knew a little bit more, would make our budget, our pocketbook, our vetting, our time more efficient than buying all this gauzy bandages that sticks to a wound, or having to go put on comfort boots so your horse can get from the hay trough to the water trough
Mm.
when you really need them to be moving 3 or 4 miles a day to stimulate the hoof growth.
Oh, I'm so excited to dive into everything. You work with a lot of horses that have mysterious lameness or behavioral issues that are not easily diagnosed. What are some of the most common underlying problems that you uncover that traditional methods likely will miss?
So torn suspensory or tendon, what does
Oh,
a vet
that's
tell you to do?
well
Ice
with
it, stall
mhm.
them. Do they tell you to put them on MSM or arnica or anything that speeds healing? No. You better be taking them off grain, because if you have to hand walk that horse that's been locked in a stall who's rearing and jumping sideways, how is that helping that leg heal? But also, he didn't look into why was that leg loading so much that the suspensory or tendon has a strain or a tear. They don't even look at the other front. So if it's in the right front, what's not working well in the left front or the left rear that's throwing extra strain to the right front?
Hmm.
If you don't find those causes and work it out, after all the stall rest and the wrapping and the red lights and whatever you've done, when you're bringing them back to work, it's just going to tear again because you didn't address why it tore in the first place.
Hmm.
I mean, if the horse comes in and the shoe's ripped off and it's hanging on the fence and you know how it happened, that's different. But if all of a sudden your horse is off, you ultrasound and it's there, it's been building up.
Mhm.
So I actually have a video on how to palpate the suspensories and the tendons. Being a 50-mile endurance rider, you always had to check that, especially if you're doing 50 miles, 3, 4, 5 days in a row. You better know how to check those legs. That's like, is your wheel loose on your car? You better know how to tighten the lug nuts, right? If you're
Mhm.
going to drive, from California to LA, you're like, well, how's my tires? How's my whatever? Do I need an oil change?
Right.
Is anything bald? So nobody's looking at all of that. When I do a first session on a horse, I use a product called Dynamite Release, and I put it on my hand. I put it all over their head, and it will lather and heat will come out where the cranial bones are compressed. And I do the kidney 27 point, the conception and governing meridian to open that up, but I do all inside the hind legs. And if the right hind leg is super tight on the inside of the gaskin or the hock compared to the left, I've got to go see what's going on in the left front. So the people that are treating horses, the veterinarians and stuff, don't usually don't know about the diagonal. My horse doesn't want to take right diagonal or what's going on. They don't realize we're sitting on the weakest part of the horse, the suspension bridge. And if the left front can't move well, they're going to throw shift, to the right hind till that gets sore, and then they're going to throw stress to the right front. So by the time you see a horse bobbing its head at the trot, it's like three-legged lame. So my new clients, I spend extra time. I show them how to do the suspensories and tendons, especially on barrel racers. We worked on a bunch of barrel racing horses yesterday, and they expect me to check the legs. How's your horse doing? He's doing really good. I can't find any soreness. I have a 5-step horse yoga, that I have my clients do. And they do it before and after every event. Okay. If you have a glitch in that yoga, you have a problem you need to work out. If there's leg circles down to a stretch and drunken horse pose, and if the right goes really well and the left slams down, you're not ready to ride that horse, because that tight left front is going to throw back to the right rear. The kissing spine that you get is either in the withers or the lumbar. I've had people say, my horse was diagnosed with kissing spine disease. It's not a disease. It's not catchable. It's an issue. And if you look it up, the bones are too close together. Muscle pulls bones. So it's only in the withers or the lumbar. So the front end is too heavy or the hind end isn't working well. We just need to figure out what we need to do to release the muscles, and then the bones could start to come apart again. Everyone's always like,
Just
do you see anything wrong in my horse? And I'm like, it's like a Van Gogh painting. It looks like this to me. And I finally put that in the fourth book, what I see when I see a horse.
what I see.
And the lady who does the drawing, I actually had to say, can you drop this nostril and this cheekbone a little? So even on the picture that she drew for me, you could see that the horse's head's a little off. And
Yeah.
these are all on Amazon, and we just got them on Audible as well for people that can't read or just want to listen to it when they drive. I have the podcast. Like, here's that thing where I was talking about measuring the horse's head.
Yep.
So I can walk right up to a horse in a stall, look at the 4 feet and look at the head and tell the rider everything it can and can't do and what issues they're having, just because those are all long standing. And when we do the program that I teach and the owner involves in the horse yoga, the farrier is like, oh my God, I can finally balance out these feet. And these are amazing hoof walls now. Where'd the white line separation go and all the fungal? And oh, we did this little hoof soak, that cost me $10.
Oh my gosh. You're a lifesaver, truly. Trust
So
me, after this interview is done, I'll be going further with this because I just want my guy to be comfortable. We don't do much riding anymore. A lot of times we're out, we hike together, but it doesn't matter. I want him to be as comfortable in his elder years as possible and to have a happy life. And we're just two old farts having fun together. But I want him
but
to be
that's
happy.
the majority of my clients are over 50 on a smartphone, don't want to be, and just want a good time with their horse. They had horses as a little girl and they got back into it, but they don't remember the horses as a little girl having all these issues and such high vet bills. And why is my horse like this? So for those people, I have a podcast page, and
Okay.
most of my podcasts are under 6 minutes and one subject. And people are like, oh my God, I had to like rewind it. You didn't even say anything about who you are. You just went right into, we're going to talk about uveitis or we're going to
Yeah.
talk about how to get better soles. And they like, I had to rewind it.
I will put a link as well, a QR code for that as well, folks, for our audience members. If you want to check these podcasts out, they are really cool because they are just to the point and you're not like, oh my gosh. Oh, I lost track of what she was saying. Like they're perfect, just perfect bites of great information. So just scan that QR code and it'll take you right out to April's podcast and you can check them out for yourself. You're going to get a lot of information, folks, as you're watching this interview and lots of links and QR codes popping up. Don't hesitate to get more information because let's face it, we need to do right by our equine friends. April, you talk about the impact of cranial trauma from a horse pulling back while tied. Always one of my, honestly, most of the time I don't put horses in cross ties. I feel like they're claustrophobic. I just don't feel like it's a comfortable place for them to be. That's just me. Can they cross tie? Yes, but I prefer that they know how to ground tie. And I always had really funny horses that just liked people. So they didn't care if it was the vet that was there or somebody doing massage or the farrier. They were just like, they would be happy to just hang out. So, um, because I just didn't want that to ever happen with it because it just can and it does. Can you explain how this trauma affects not only their behavior but also their metabolic and immune systems. But you went into that with the
Right, but it's mainly so the young horse, when the cranial bones are so soft, is when the
hmm
damage is done. So
hmm
I was working for a client and he'd kind of round up the horse at 5, 6 months old, snub it to a post and let it figure it out. And I'm going, oh my God. The next time he had a baby, I had a little rope and we kind of taught it to give to the head. We did itchy scratchies. And within 4 sessions, it was tied on a little bungee next to its mom in the stall. And you could pick up its feet and do itchy scratchies and kind of groom it. And he's like, oh, wow, a little extra time at the beginning. It makes him so much easier instead of letting him run wild and then, tie them by their head. So some horses that people can't deal with because they're having the behavioral issues, they get sent to a trainer who says, just put it on the patient's pole, just put it on the wall for 6 hours. It'll learn not to paw, and
Mhm.
stuff. But when it's under here and they shoot backwards, they won't stop till something gives in the rope or the horse. So before I knew about cranial and all the body work, I was retraining problem horses. I had, the regular halters with the square thing. I would clip a bungee kind of rope to the side and notice that if they pulled on the side, they'd immediately stop. So it's only when they're pulling straight back, that rope hits here, and then they're in that fight for death, right? Fight or flight. They can't get away. And it's doing all that damage in the nuchal ligament. That horse, when you have scar tissue on the nuchal ligament, can never really get up on the bit. If you want a dressage horse or a halter horse with that lovely headset. When you look at the neck muscles coming down from here and the nuchal ligament, you'll have a flat zone here, and they'll have big knots farther down their neck. But when they do pull like that and then they lean to one side, I've seen people have to go over and cut the rope, when you have those unbreakable ropes and stuff, they shift everything down on one side. So this eye can no longer see as well. So all your horses that are spooking, I show all my people to take your hands like this and cross them. This is how your horse sees. You cannot see right in front of your nose. So having a carrot or a treat there, they can't see what's at the end of their nose. But if you're like this looking around and you shift just one of those, you've lost your depth perception and your peripheral vision. So the horses that are spooking, I tell people, notice if it's always on one side. Oh, yeah, it's at the garbage can when we leave, but not when we come back. Because it's only the left side that didn't see it, has some issues in this eye. And then the right eye will come around and see it. And because this eye didn't see it, it has to be a
Okay.
carnivore or something scary because it moved. It wasn't there a minute ago. This went, So I used
Uh-huh.
to desensitize horses before I even did any of this and teach them to go up to mailboxes and porta potties and push them with their nose and like give them a carrot treat from horseback. And they had to touch it with their nose. But I didn't even know about any of this stuff. But just feeling confidence in the rider that they're safe in their own space. But when they've taken this head trauma, up here is always on fire. It's smushed. It's kind of like having a concussion, hitting your head really hard, and it always hurts in that spot because the cranial bone is kind of compressed there. Those are the horses, don't touch my ears, don't
Mm.
want to be bridled. So then they get into all this training of put your head down instead of addressing this. I worked
Mm.
on one horse in London that they got from a feedlot, old thoroughbred. He's only about 10, rearing, and I had to spray the release in the air over him. By the time we finally got down, fixed his head, did all the body work. The owner came to pick him up 2 days later, and he's like, "Where's my horse?" And here's this chestnut gelding with his head down, and the kids like petting it. They're like, "That's your horse." "That's not my horse. I brought you a fire breathing dragon." He said, "No, the kids are just petting his head. He's down here like this. That's your horse." Oh my God. And we got him sound too. So it was just, all the horses that are going to the rescues are just trapped in painful bodies, painful heads, and nobody's getting it. And they don't understand being sold. They work from the heart. They've given everything to that one person. They can't do the job anymore and they get thrown away, usually pretty cheap or free. So then they get a pretty cheap saddle and bridle with the new person who doesn't know anything about saddle fit. And they're in more pain and they don't understand being sold or given away and not being with their heart person. Yeah. So to me, that's what I'm trying to stop. And we have 8 instructors working for me globally. So we teach in 5 different languages. So there's no excuse not to learn my program.
Wow. I'm going to learn it. I am.
So we
Oh.
have the hands-on clinics, but I also have the home study program for 100. But that comes with a distance reading on your horse. So I'm like a medical intuitive, and I scan the body and I give you an 8-page report. The cranial bones are dropped on the left. That eye vitality is only 45%. You're probably having issues with those eyes. You need to release the atlas and axis first rib on this side. So you get videos, you get a workbook, but you don't just get dumped there like you do other home study programs like, thank you for the money. Hope you figure it out. I hope to never hear from you again. Gone. And, so within a few days, they get an 8-page report on their horse of what to detox, why they're having the issues, and they work through all of that. And then they get to resubmit pictures to make sure that they got it all.
Okay.
And then you're just doing that on every horse. Every horse has pole trauma from pulling back. Every horse has first rib misalignment. I think it's because our horses are more mineral deficient in the feeds and the grains, because first rib misalignment used to only be on one side for 20 years of doing this body work. And in the last 6 to 7 years, we're seeing it on both sides. So neither shoulder can move, and that's why you're seeing more kissing spine. The first rib misalignment on both sides. Both shoulders have this, when you're trying to canter, it's like this thunk, because they can't. The rhomboid and trapezius muscles are trying to bring the scapula through. So, but it shortens the withers and the lumbar. And all you have to do, is free up the body and realign the first rib. And the reason it's in the home study program is because it can come out every week. Anytime they run through mud bog, gopher hole, and that leg goes down. Anytime the horse is leaning on a solid board fence to graze on the other side. Anytime the shoulder goes down, the first rib just kind of tweaks and the shoulder just can't move. So it's not that it hurts, it's just not moving as well. That's the horse that doesn't want to take right lead canter. And the trainer says, oh, it's just a weakness, make them do it more. So you keep doing it, right? So that right stifle and that inside left hock are going to compensate because the right shoulder can't pick up. So then you start to see the issues in the hind end. So it's not that the right shoulder hurts. It's not moving well, and the hind legs need to do more to pick up that right lead canter for you.
Makes
On
sense.
barrel horses, if the first rib is out under the right shoulder, they're going to do 2 barrels really good to the right, but they're not going to get their shoulder around to come barrel to the left. People go, that's
right. Because you do hear that with, well, I follow a couple professional barrel racers. Like my horse really does better going to the left or to the right. And, well, there's a reason for that. So not that they just picked it like, yeah, no, I really like going to the left. I just do. Wow.
So here's
Yeah.
something else for you. On the other side of the planet, when you flush the water or the toilet, the water spins in the other direction. Our foals are born predominantly left. It's which shoulder comes out of the womb first. In Australia, they're born predominantly right. So
Stop.
our racetracks go to the left and Australia racetracks go to the right.
Oh my gosh.
Cool,
Wow.
huh?
Yeah. So you teach horse owners how to do this work themselves. I mean, clearly, because I think, well, Dakota's running around playing with his yard mates, his herd mates, and then he takes a misstep, slides in the mud, whatever. We'd be like bringing somebody out once a week, right? So we do need to know how to do this work ourselves. What are some simple but powerful techniques that owners can start using right away to improve their horse's skeletal and muscular health? Or will we
So
find that in your books or in that you sent me a link and where we send the pictures and do all.
no, that's a distance reading. So
Oh,
that's
okay.
the horse yoga. So my clients kept saying,
Oh.
my horse is happier to see your car than it is to see my car. So I had to do something to get them involved. And when you're doing that, even if you haven't done my bodywork program, by day 3, they're like, my horse has a different attitude. He's actually waiting for me at the gate. I saw my horse out there doing downward dog all by himself, So, the carrot stretches back to the stifle. You want it lower down towards that rear knee. And if your horse can only reach its shoulder, or ribs 10, 12, you've got a lot of issues in the neck. But just doing the yoga every day, because Atlas and Axis are the ones that actually come out, but C3 through C7 just kind of turn and lock down because of muscles. So you're stretching out the muscles by doing the horse yoga. I say go out there with 5 pounds of carrots, do left, right, until you get them back near the hip. When you go this way, you're going to be breaking down the arthritic calcifications on this side and stretching out this muscle. And when you go this way, vice versa. So you'll see short neck, long back horses because the neck's in spasm, bringing 5 and 6 too close together. That's your U-necked horses. And when the back goes into spasm and the psoas is in spasm, it's straight to the croup. So it looks like a long backed horse when it's not really. So it's all in that balance. So then the leg circles down to the drunken horse pose frees up ribs like 2 through 5. It doesn't do the first rib, but that's all your turning, your barrels. If you can't go like this and cross over the other leg, how is that horse going to move that shoulder to go around a barrel or to do gymkhana? If your psoas is in spasm and your lumbar is locked up, how is that horse going to pick up the stifle on the hind legs to come over the jump? When you see the hind end of a horse and your hocks and your hooves are so close together, I'll see that on 4 and 5-year-old barrel and racers. And I'm like, are you injecting those hocks yet? And they're like, yeah, how'd you know? Because your hip, your hock, and your hoof are not in alignment. Your hip's out here, your hock's in here, and your hoof's in here, and they're so tiny with an inside crushed heel. Why didn't my vet say anything about it? I don't know. Why don't you ask them? I've seen vets pass horses for $30,000 and $40,000 pre-purchase exams for 100-mile endurance horse that are U-neck, roachback, hunter's bump, and have 4 hooves that don't match. I'm like, how can you pass that to be a 100-mile endurance horse? Oh, we just keep injecting the joints until they fuse. It's like, so you're making it so we can't feel the damage that he's doing to him.
Right. But that doesn't stop the damage. It just continues, right?
Right.
You just can't feel it.
Side bone and ring bone is the front feet not loading correctly, like you getting arthritic ankles. So when people say, how do we get rid of that? We do the apple cider vinegar in their feed, which works on arthritis from the inside. Then you have to change how the front end is loading to be correct. So the shoulder, the knee, and the hoof are in alignment because those horses are all base narrow, and that's not conformation, that's posture. And then we have something that we call a bomb sweat that you do once a week that breaks down those excess calcification, because the coffin bone and everything is dense bone, but the excess grows. The body sends calcium to heat to lock it down, grows like porous, like a coral reef. So you can break those down and the body reabsorbs it. People are like, wow, my horse has that back instead of thunk, 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 thunk with like lock little, fetlock joints.
Oh my gosh.
I'll have like 14-year-old girls go, can you ask if my horse wants to jump? I says, it has arthritic knees, hocks, it has side bone and ring bone. And you want me to ask if it wants to launch into the air and land all that?
Right. Oh, definitely. That sounds exciting and wonderful. I love pain. Oh my gosh. Oh,
I said, why don't we get healthy hooves? Why don't we get rid of this arthritic calcifications and then ask if your horse wants to jump?
right. Oh. You have an extensive collection of free educational resources, thank you, including your YouTube channel, podcast, horse yoga. What is your goal in providing so much free content, which I think is amazing? And how do you hope that it will impact the equestrian world?
I get emails daily that say, I stumbled across your YouTube video and you just explained everything that my horse is doing. And the vet left with a $500 bill and didn't. So it's not that we don't need the vets, but they don't ride. They don't understand working a diagonal, and what's going on in the body. So what I don't teach is how to do the first rib release that starts everything. So you have to buy my program to learn that. But I do show you how to palpate tendons. I do show you how to lift the ribs and do the butt tuck if your horse is colicking. I have a whole video on get out your digestin from doTERRA and saturate the belly. And, in my Horse 102 book, it says, have a laminated sheet because as soon as something happens to your horse, all the information goes right out of your brain and you go into panic. So have Banamine at the barn, have doTERRA Digestan at the barn, have Epsom salt, because you can syringe them with warm salt water. On the side of the Epsom salt box, it says take for constipation. And what is an impaction? So you can syringe warm salt water. It's all these things you can do while you're waiting the 4 or 5 hours for the vet to come. And then usually your horse is pooping, if you do all my things, and then you're like, thanks,
Never mind.
don't need you. And it's not to get the vets out of work, but they might have to go, a calf is stuck or a horse needs stitches. And if you can get your horse out of colic, we have fewer and fewer good vets nowadays. They're just not finding it as rewarding. That if I called my vet, Larry Goss in Sacramento, he knew it was an emergency because I was treating everything else. So
Yep.
even if it was his day off, it was Memorial Day, he would come out to the farm. I'm
Yeah.
like, she just foaled. She's not up. I think, she's running a fever. The baby's running around doing flying lead changes, but we need something for the mare. And I actually I had bred for a tricolored sweepstakes Pinto Arabian sport horse. I finally had it, and she was about 3 or 4 weeks old, and it was 105 degrees in California, and flies were everywhere. So I'd put the war paint on. That's what you use, like a spot on for ticks. And I'd put it here, and it made her itchy, and she rubbed, and she caught the metal flanging on the side of the building, and she nicked her carotid artery. So you go out and you bred for this, and you go out and your little, oh my God, I finally got the horse I want, spurting blood all over.
Oh my gosh.
So remember, I imprint my babies. So I caught her up. The dynamite trace minerals that I put in wounds, I put it in a syringe and I just injected it in all areas of the wound. And I gave her some molasses electrolytes because it was every time she went up to nurse, she would open it.
Mm.
So I waited 3 hours for the vet to come because it was a holiday, of course, and my vet was off. And so he came and he's like, how is she still alive? I said, well, that stuff that I put in all the wounds. And when you geld them, I'm like, wait, because we put these drops in when they geld them, there's no drainage the next day. The worst thing you can do is cold water hose, like the vet says, the injection site, and you get all the pus and the drainage that attracts the flies. So as soon as he would geld my coats, I just put this right in the hole. Next day they're up and there's no drainage. So I had injected that in there. And then while he was trying to get his hands on her, she sprung through both guys like a gazelle, and she's all over my yard spurting blood again. And I'm like, ugh. So I caught my baby, and this trace minerals I use, I put it in a little syringe without the needle, and I inject it up there, and I get the bleeding to stop. And he gets to sedate her, and had to, like 5 IV bags of fluids and all this. And he actually had to stitch the carotid artery closed. It was so bad. And just that her body will make other pathways. She's so young. But he's like, how did you keep her alive? How did you keep her from bleeding out? Well, that stuff I use.
Wow. Oh,
So
I'm
it's
going to
amazing.
love all your books. I'm
So,
going on
I
a
do the
shopping spree when I'm done here.
And I do the distance readings. I do them for people as well on their health issues, bacterial, viral. I found people that had like deep bone infections that was draining down into their body. One person ended up in ICU till they actually found the tooth infection that is vet missed. So I find all those things, and then we just use kinesiology for what does the body need to come back to balance? What does the body need to heal, instead of adding all of this stuff in? Do you need red light therapy? Do you need MSM that speeds connective tissue repair? Do you need arnica gel? Do you need cold laser therapy? I just kind of bring all of that in. And what do you have at home? Because it's very expensive to have a horse. Well, I have these products at home. Great, go use these.
Nice.
And guess what? How it's all going to be so easily available to everybody.
Tell us.
For 4 years, I wanted to make a phone app. When you get to the barn, and oh my God, your horse is not doing good, and you go into panic, and it's let's
Eight
see,
o'clock at night.
yeah, when nobody's going to help you.
Mm-hmm.
Holistic horsework remedies. So we're just getting it finished in the Apple store. And it was like, I have all the information out there, but people don't want to be looking for it. So you're going to log in. You can put your own horse's information in here, their shots and all that stuff. But if your horse is limping, it says, here's a video, check the hooves, check the frog. Here's how you palpate suspensories and tendons and everything else to look for. If your horse is colicking, what do you do? So we're hoping to get this out by March. It's been like a 9-month project, as you know. And it's in 5 different languages, all the languages that we teach in French and German and Switzerland and stuff. So we're really excited about Holistic Horseworks Remedies.
I'm excited as well. I will definitely get that app for sure. Will it be on Android too? So you'll have it
Yeah,
be in the Google Play Store?
Google
Wonderful.
Play Store and Apple.
So we're pre-recording this the last day of February. So hopefully, folks, you're looking at a link to go ahead and get that app and have everything at your fingertips in one place. That's exciting. I'm excited about that. I feel like that is so empowering as a horse friend. I hate to say owner, but uh, you're right. You do panic initially. It's like, I don't know what to do first. Call the vet and and to have everything just kind of boom, boom, bullet pointed. You got to look at this first and that, da 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 da. And oh my gosh, I could have used you a couple weeks ago.
Well, I'm always here, and I always tell people if you get this in paperback, make sure you put barn copy and your name on it because people will take it home.
They're gonna walk off with it? I don't think so.
My client, her horse was colicking at 11 o'clock at night, and she goes, "The book was at home. I knew you were asleep, and you'd have your
Wow.
phone off." And I have all the pictures and what, your horse might be colicking from and what to do. And so you should have it on that laminated sheet: colic, digestion, and mouth and hair, butt tuck, belly lift. Those 2 things on the yoga lift large and small intestine because you have a blockage.
Mm,
It's not a mysterious colic. Something's been adding up. Your horse might be pissy at the trot if it's sand, and uncomfortable at the canter if it's an enterolith or a stone, because that's when it
mm.
comes up and it hits, in that repetitive pattern. And they're like, is that why my horse, when he's trotting, farts? Yes. They are not. We used to laugh at those horses, gas powered horses.
Mm-hmm.
All of that's backing up until the intestines are moving and the gas can pass. So you need to start working on the apple cider vinegar and the sand. And when we do the yoga, when we filmed my first one, just all the butt tuck and belly lift and butt tuck and belly lift, that mare went in her stall and had this huge pile of poop. Just lifting their intestines gets old stagnant stuff moving.
Oh,
So I've had horses that got swept downstream in a river and caught up, in under wire branches. It was her drill team horse, the big 50-pound saddle, and she saw her mare dying, and she's yelling. She's in the river with it, and they get out, and they had to be helicoptered out the next day. But they're like, you can go home. No, April would say, do bladder sweeps and yoga. As soon as that trauma hits, you have to have something to realign the body and to calm all the meridian systems in the mind so that the stomach doesn't shut down and they don't go into shock and they don't go to colic. And the vets are like, wow, your mare's like so calm and she's just eating. And she'd say, oh, yeah, April would say, do, bladder sweeps, yoga,
yeah,
realign that body, remember where it needs to be. So I want to be like your little
absolutely.
first aid kit.
Yeah. I mean, not to be, too much information here, but I'm kind of a gassy girl. I like sauerkraut. I love fermented foods and that and cruciferous things because it's good for me. But when I eat them and I'm out in public, really what I want to do is go home and literally like lift my back end up, right? It's like it's a lift to get that gas to move. And it's like it's instant relief. But if I can't do that and, like, oh no, there's 2 more hours to this date, you know what I mean? I will be dying. Imagine what your horse is going through.
Well, they can't burp, right? It's all one
Right.
way. So, and it's the haze and grains that are blocked that are fermenting
Hmm.
and creating more pressure and more pressure. So that's why they want to go down and roll to move that pressure.
Yeah.
But once you've learned how to do the belly lifts and the buttocks and you get 2 people and you do it together, it's like within 5 minutes,
Oh my
you know,
gosh.
But you still need to work on the why, the sand or the stone that's in there. But it's like, okay,
Right.
great. That wasn't an $800 vet bill tonight. So it's just a
Right.
wake up call. I remember seeing something about mysterious colic. It's, it's going to happen again. And it's going to happen again because the vet coming out and oiling and doing all those things didn't work on what was blocking it.
Right.
I actually
Absolutely.
had a client, and you can't recommend this, but they'd sent the horse home to die. They couldn't find anything from Loomis Basin or whatever. And she said, bring it over. And she had a warm water wash rack and she gave it an enema. And out came a plastic bag. Because when you put your hand in for the rectum, you're not going to really feel a soft plastic bag. It's going to just be warm and move with the poop.
Oh,
And the vets don't want you to hear that because if you have a tear in the intestinal lining, the bacteria can go somewhere else. But if you're 6 hours from a vet and no one's coming out and your horse is dying, I say go get your home enema kit and put some warm water in there.
yep.
The other end. So
Yep.
there's all these, common things that we can do instead of saying, oh my God, I'm just going to watch my horse die in pain because I don't know how to relieve this gas.
Indeed.
My people clients, I always say, go get 3 colonics within 21 days and all of that'll be gone.
Mm-hmm. Hmm. Oh, my horse and I have a lot of stuff we got to do.
Yep. So, I'm going to do the distance reading for you, and you'll see that, the eye that needs work will be the one that's weepy. So, when the lacrimal
Mhm.
bone shifts, it blocks that tear duct. So, you know how they can go up the nostril, right? There's a little hole up in that nostril that the vet can put the, little water and kind of flush. And people have tried to flush that out and wonder why they can't flush the tear duct out. It's because the whole lacrimal bone is shifted and it's compressing.
Yep. Yep. Nothing can get through. Oh my
And people
gosh.
say, I'm so depressed. You just mentioned my horse. I said, but I don't mention anything that we can't make better or that we can't work on.
No. Right. Right.
So the level
I'm
one
very
home
hope.
study is the cranial, and I have just a cranial video for like 70 for people that just want to work on the head. And the level two is that, but all the fascia, all the muscles, the base narrow, the hocks that are too tight, the thoroughbreds that suck up their diaphragm on the racetrack, the horses that roar. You've heard about that in the tie
Oh,
back
yeah.
surgery, right? Did you know the tie back surgery is only on the left side of the body?
I did
The
not know that.
laryngeal nerve runs in a different pattern on the left side of the horse's body than the right. And if all the cranial bones are compressed on the left and the first rib is out on the left, it's compressing both ends of the laryngeal nerve that signals that flap to open. So we've gotten stage 4 roar back to like stage 2 by doing all of this. And then we did laser therapy to work on scar tissue and then nerve regeneration herbs. So when people say, have you heard about this? I just Google online, what is it? What does it mean in the body? And what does the body need to fix it?
Yeah.
And it was actually the vet said, yeah, it is always on the left. I wonder why. Oh, the laryngeal nerve wouldn't be compressed by those on the right because it goes somewhere else.
Hmm.
Yeah, there's all this stuff in my brain, which is why we did the podcast and the books, because I'm like, I got to get it out there so it'll always be out there. And then we're going to have the little phone app and people just go, doo, 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 doo. So the podcast, the videos will be in the phone app too. So they don't have to go somewhere else.
Oh, wonderful. Oh, that's great. Yay. Yay. Yeah. Because otherwise you're hitting all these different platforms, but to just be able to open up that app on your phone and have those podcasts too. Because I love listening to podcasts in the car. So I would just like binge on April's podcasts until, I'll
So
just do an extra long drive so that I can get a whole bunch in for sure. Oh my gosh.
And a
I'm
lot
very
of people don't have cell phone service at the barn, but if it's in the app, you should still be able to access it because it was
right.
downloaded in the
Down.
app. So that was the only way that we could get like the colic video and all that information to you when you have no service and you're in panic. And I keep dropping the call with the vet and they don't know when they're
Mm,
coming. And
nice. That's nice that you have that option to download once. Yeah. Because even like sometimes when you have I have Audible, which I love, but if I don't download the book, and then I'm somewhere where the Wi-Fi service is bad, then I can't listen to it. But I make sure that I download the book prior where I do have internet service, then I always have access to it. So that's nice to know too, that you're not going to be like, I opened it up, but there's nothing there because I don't have
Oh, yeah,
that.
because you
Great.
download the app and all the info's in the app.
Love it.
So I have over 200 helpful YouTube videos, and they did limit me to 15. So you're just going to have to go on YouTube on Holistic Horseworks and find all the other ones. But every part of the horse's body, from crooked heads to everything, is in there.
I love it. I don't think there's anything like that out there right now.
No,
So
I
this
wanted
is,
one. I've been wanting to do it for like 5 years. It's like, $8,000 to put it together and
oh yeah.
stuff. So it is like a free trial for a week and then like $5 a month. But
Oh,
when
that's
they pay
nothing.
that, they get 10% off any of my programs. So you can buy all that in the app and save. So it's kind of like a win-win for everybody,
100%. That is one Starbucks coffee, not even. Part of it's a
right?
half a Starbucks coffee.
No, that's a black coffee with no sugar, no cream
Don't make it
nowadays.
fancy. No,
Can I
that
have
is
half a bagel?
no cream cheese today.
1 gallon of gas. Okay.
Exactly. That's phenomenal. And then to still get 10% off of the courses on top of it is just, it's phenomenal. I'm
Well,
beyond
and you get
excited
to put
about.
your horse's info in of when the shots were, when the farrier was. So you have everything right there. Oh, let's see.
I'm
When
s-
was the last time he colicked? Oh, yeah, it was 3 weeks ago because I actually have it in there now.
wow, all your data's in one place. That's perfect because now you're not scrambling. If you do have to call the vet, you're not like, hang on a second. Let me oh, I don't know, when
Let me pull
was
up my
that?
calendar for when was his last shot.
Hey, April, I think you should develop an app for cars too. That would be perfect for cars. Huh? Right? That
Yeah.
was me last week. I'm like, when did I get that thermostat changed? My car's overheating. You know what I mean? And I'm digging through paperwork when, oh, there you go. In your spare time, wink, wink, you should develop an automobile app too, because you already got all the you got a template down. It's just we're gonna transfer it to cars.
Well, I like the app of what was wrong with my plant, right? And you could take the picture and it would tell you what to do. Well, you can send me pictures of your horse and I can tell you where the pain is, what hip is out, and what you need to do. So, with all other programs, you don't get that live help support of, hey, what's going on with my horse today? Can I get a reading? A reading's $100. What's a vet farm call?
A lot. My last vet bill 2 weeks ago was really close to $1,000 for just, and he didn't come out. It wasn't an emergency. It was an urgent care. He picked up Streptococcus zooepidemicus, which, opportunity. Yeah, there was another boarder's horse on the property that had an open abscess under its jaw. And thank God Dakota he's a healthy guy. He really, really is. So I knew I was dealing with bacterial. It never got above 102 as far as his temp went, but he did have clinical signs, a little dry cough. And so the vet had me monitor him for about 24 hours and came out. And I said, I need to know exactly what this is. Have to be sure we're not, that's not going to be Streptococcus equi or, like I need to know. So that was not a cheap.
No, see, if you were my client, I have a recipe called Miracle Spray that you can buy on my website. That's
Okay.
doTERRA essential oils and the dynamite trace minerals. It works on bacterial, viral, and fungal. And they're all edible. So while it's actually for the sole of the hoof to kill the white line fungi and tighten your hoof wall and give you a thicker sole. So barefoot, you actually have the concavity of the hoof.
Hmm.
It's the only thing we spray in wounds, and you can spray it right in their mouth anytime you think that they're a little bit off. So I get used to looking in the deep pupil of the horse's eye. And when it starts to look a little bit dull, you can just top dress this on their feet or put it in their mouth. It tastes like peppermint and cinnamon,
What is the
and
name
they
of that
like it.
again? And you sell this?
Yeah, it's the recipe is on my website because shipping the liquid was just too much
Okay.
leakage and stuff, so that they can make it up at home. And I just call
Okay.
it my miracle spray. In Australia, they call it the bloody miracle spray. Just go get the bloody miracle spray.
The
Because you can put it on wounds, you can put it in their mouth, and it just within 24 hours, it just boosts the whole immune system. And so if you know that there's a sick horse in the barn, you can be
hmm
preventative by boosting their immune system,
hmm
because everything they eat the same, they drink out of the same water trough. What can I do to boost my horse's immune system when I can't separate them from that horse's water trough?
Right. What
You know,
what do you think about colloidal silver? Do you have any thoughts on that?
it works great on mucous membranes. It's what we use for eye infections, but you have to put it in distilled water. You have to do it 2 or 3 times a day. You have to syringe a large dose to a horse, and you'll end up wearing half of it. So I just have some other products that work a little bit faster for antibacterial. So, but it is what we use in the horse's eyes, for infections. Sniff up people's nose to get rid of anything that's going on in your sinuses.
That's
When
what
I
I
get on
use.
airplanes,
Hmm.
I have it in a little, like saline nose spray bottle. I took off the cap and I put colloidal silver in. So before I go to the airport, I just put a drop in each eye and a sniff up each nose to coat the mucous membranes every 2 to 3 hours. And then I can just wash my hands with it when the seat belt and stuff. Because I live on Maui. We have a lot of tourists coming in, and I'm always, when people get off the plane, I'll see you in 3 days. Or did you do your colloidal silver? Because I now offering wellness stays at my house where people book with me to stay a week, and I start working with them before they actually come. And then I do 2 2-hour sessions, and I blend Healy, microcurrent, and the medical intuitive. So they actually start working on stuff before they come. And then I check like bones and feet and ankles and first ribs on people. So first rib on people is your tendonitis, your bursitis, your carpal tunnel syndrome, and your frozen shoulder. When
Mm.
the first rib is up, your collarbone can't move forward. So you're using your rhomboid and trapezius to pick up your neck. And you're like, my neck's like this now. I have a little short neck, just like my horse. I have a little short neck. Instead of your shoulders being out here and down. And then that impinges everything going down the arm, and you get the hands that go to sleep at night and stuff. So I work on all of that, and affirmations of what people say. Don't own a disease. Don't say, go get the Cushing horse, or don't say my cancer. I change
Hmm.
people's language. Western medicine has this theory of what's going on in my body. And me, I know that it's a stem cell gone bad in an acidic environment to have cancer. So I'm going to make my body alkaline so that that can't thrive. So what do I need to do to be that environment? So that's what I help people with too.
I love it. I am a true believer that the body can heal itself. I'm 61 years old. I take no prescription drugs, no medications. I live a very healthy lifestyle. Um, and I
I'm going to
agree
be
with you.
63. Yay!
Oh, there's my number. That's the year I was born. And that was fate. The universe gives me these signals, and that number will come up in really unique ways. So thank you for that.
I
63.
was
You look amazing,
I
woman.
was born in 62 and 62 this year. I'm like, oh, 62, 62.
Wow. Yeah. Oh my
So,
gosh.
and when I met my health gurus, I had tendonitis, bursitis, carpal tunnel syndrome, sinusitis, chronic fatigue, and Lyme.
This
So
is
it's
you?
getting, yeah, it's getting through all of these issues. Had both shoulders operated on before I learned about first rib in people, and our shoulders moving correctly. So I actually had to feel everything and experience it in my body before figuring out. And I tell people, you better be doing yoga, you better be doing some stretching, you better be doing some self-care.
Absolutely. Yeah. Yeah, our lifestyles are not conducive to good health, truly. But
Everybody's like this on their little phone.
oh my
I'm like, bring your
gosh.
shoulders down, bring your phone up here, and keep your neck straight. You know, your computer screen, when you're down here like this, you're going to have neck and arm issues. Get your computer
Hmm.
screen level and get your arms up here like this, resting, and be in this position when you're looking at your computer, because you and I are on the computer a lot.
Absolutely. Spend a lot of time with that. But I make sure that I schedule a lot of physical. As soon as I'm done here, I won't even go into editing. I'll let this convert and compress. And I've got a hike out in the preserve with a friend with our dogs, and we're going to be out there for a couple hours. And that's just part of our routine. 20 years ago, I was diagnosed with the Epstein-Barr virus, chronic fatigue syndrome, all of that. What is it? It's whole body inflammation. What am I doing to create this environment? How do I clean it up? And
And stop
I
eating nightshades,
say that
right?
again.
They told you to stop eating nightshades, potatoes, tomatoes, things that create inflammation, white flour, white sugar.
Yeah, oh yeah, sugar. Wow, no good, no good. I can tell you if I eat sugar, I will instantly feel it in the knuckles of my hands. My body tells me exactly like, nope, that was a no-no. And you knew it when it crossed your lips that you would feel it instantly. And now, I'm much more cautious and
A
I'm not
moment
going to
on
take
the
that
lips
chance.
is not worth hours in the hands.
Correct. Correct. That, I always look at it as my body does so much for me, and to continue to hit it with things that I know are poisoning it, that I know are not good for it, is not honoring and respecting it. So,
So all the people that crave like bread and bagels and carbohydrates, I tell people that's the yeast, candida, and parasites that want to be fed. And then
hmm.
they go, ooh, but telling yourself you can't have it.
Oh, dude.
Okay, so I only use doTERRA brand, and people have to kind of muscle test if it's okay. But I've had students take 4 or 5 drops of oregano for a couple of days, and they're like, "My tummy's flatter. I don't have gas, and I'm not craving bagels anymore." That was so much easier than telling myself I couldn't have the bagel.
Right.
So I teach kind of the lazy man's way to better health, to not be craving those things, not be feeding these candida and parasites that actually have their own consciousness. And they're like, yes, I want that chocolate covered thing. Oh God, I thought
Yes.
about it all day.
Exactly. I can remember years ago where, it was hard to drive by. I won't say McDonald's because I was never a McDonald's fan, but drive by and grab something that was quick, where, experiencing good health helps you to make the right decisions because uh, even
Especially
today,
nowadays,
yeah,
it's
it's
mystery meat in all
garbage.
the to go
Oh my
places.
gosh, you don't know what's bioengineered and this and that. You look at it, you're like, I don't even recognize anything how can this have 500 ingredients that I cannot recognize? Like, what is that? No, I want the wholest form of food that I can eat. And I'd rather come home and scramble a couple of eggs and have some spinach, and I'm happy and I feel better, and I'm not, like, oh, I got to go take a nap now and I'm bloated and I feel crappy. No, not at all. I won't do it. I just
I
won't.
tell people in our 50s, you're learning that we should have taken better care of our bodies. And in your 60s, you're learning you should have flossed more.
Mhm.
Take care
Indeed.
of it or you lose it.
Yes. Absolutely. All right. So,
A
I'm
lot of
looking at
information.
there's so much. There's so much. We could go on for like hours, and I know you don't have it, and I don't either, but we could. So, where can horse? owners start if they want to dive deeper into your work, like me, someone like me?
Well, you have three different ways of, learning. So YouTube is if you're visual.
Okay.
So I have two YouTube channels. So Holistic Horseworks, you can go into the podcasts are up there as well, but there's also playlists. So you can look up wounds and arthritic conditions or cranial sacral. You can look up what you want without having to scroll through everything or testimonials. So that's for visual learners. And most of those, again, are under 5 minutes. Your horse is colicking. Here's what you do. Your horse is lame. Here's how you palpate the legs. If you want to drive and just listen, that's the podcast page. And that's also on Spotify and Buzzsprout and Amazon Music that you can find Holistic Horseworks. And 4 books on Amazon for people, and 3 of them just got put in Audible. So if you just want to listen to it instead of reading it, but the pictures are pretty cute.
Yeah.
And then the website for the left brain cerebral type, or all the information. Even when you go to Holistic Sorcerer's homepage, everyone's like, you should redesign that to be softer. I'm like, no, I want it dramatic. Here's an eye that was going to be removed. We saved it. Here's a crooked horse. This is what we did. All that information so that on the homepage, it grabs what their interest is at the time. And then each of my instructors has their own page where we're teaching in South Africa or Australia, or think Florida and Indiana is coming up this year. I'm only doing West Coast now. I live on Maui. I'm doing a private apprentice program with a lady right now who's following me around to barns. So it's what is your learning style? The home study program, you get a landing page that you have access to for life with instructions on how to download the videos. People don't do that. So anytime I update a move, we post another video in there. So my students are lifetime students, and you always get to see the new workbook or anything that we changed. For people that get the home study program or do a live hands-on class, you get to submit 5 case studies. So in other programs, you can submit a case study, but you don't know if you got the rib or you got the hip, where they submit pictures to me and I say, well, you didn't quite get the right hip and you didn't get that elbow. And we go over how you're doing the move. So having that support and feeling good, like I didn't think I got it, is that the little doubt, on your shoulder? I call it. You ever see the movie The Fockers?
Yep.
Yeah. So my third book, If I Can Do It, You Can Too, is about us and doubt, and how as children we kind of learned we weren't good enough or we weren't smart enough or we couldn't do that. I call that the little fucker on your shoulder. Just knock them off and just say, yes, I can do this. And
Mm-hmm.
with your horses, find a teenager at the barn or something and teach them. I teach the yes no divine pendulum to ask yes and no questions. But when your horse is injured or sick, you're not going to be able to do it. So bring in that kid to say, what's going on? Does he have a bellyache? Did he eat something? What do I need to do? Have some kind of support at your barn, that can help with all that while you're trying to get the vet on the phone. And, have that list of, what do you do for the injury? What do you do for the colic? Laminated at the barn. So you're like, oh my God, I forgot that. I have it in my pocket. Great. Let's go do that.
Yeah.
So, on your home study or in-person class that we teach, you always have this follow-up backup. You're not just, when I took a course, it's like, okay, how do I go get clients? What do I say? You go to a horse show, no one's going to let you touch their horse at a horse show. You might mess up something.
Right.
Right. So I would donate gift certificates of what I wanted my session to be worth, $100. So and I said, I don't want first place to win it. I want the best sport award. The little 4-H kid that's always trying and always coming in last. I want them to get my award.
Oh.
Because if you fix that horse, they will tell everyone in the barn about you. So I actually
Mm-hmm.
show people how to go get clients, especially when vets are trying to say in all these states that you can't work on horses. Well, just say you do cranial sacral because they don't really know what that is, or you teach horse yoga, for the owners to do. It's the wording of how do we get around. We're not diagnosing, we're not treating. We're finding the blockages in the horse and opening it up, and the horse is coming back to health and wellness.
Mm. Thank you.
You're welcome.
Thank you. Oh my gosh. Oh, we have come to the end. Is there anything else that you'd like to share with our audience
I
that we
think
might
it's
have overlooked?
probably pretty much all out there.
Yeah. And for our audience, again, you're going to see QR codes popping up all over throughout this video. You can just pause that video and aim your camera at it and go out to April's website, get all the information that you need and want. And hopefully, when this airs and is published, we'll also have the QR code for the app.
Holistic Horseworks Remedies.
Yay.
Yay.
April, thank you so very much. You are a
Thank you, Kimberly.
powerful human being. And I know as someone who loves her baby Dakota and her dog and all living things, I thank you. I thank you because this is clearly an act of passion on your part. And you've put so much into becoming who you are now and that you share so beautifully with everyone. I'm grateful to you. Thank you. Thank you.
Thank you. Can I say one thing about doggies and cats?
Yes, please.
Stop feeding them tap water.
Even if it's
That's,
well water?
yeah.
No well water?
All the distance readings I'm doing, water's coming up as the main source of health issues. So we have filtered water. Start doing filtered water for your dogs and cats in the house.
Okay, I will. I have a Berkey, brand new. It's in my storage unit. I'm going to bring it into the house and I'm going to start using it.
Yeah, wells
Thank
need
you.
to be bleached every year because rodents and bugs die in it. So usually have bacterial or high iron, and all of those things throw cells off. So with our pets, that means so much to us. All the tumors, all the weepy eyes, all the pet issues is because we're still feeding them tap water.
Oh my gosh, I'm on it. Thank you.
You bet.
You hear that, Tommy? You're using the Berkey from now on, baby.
Filtered water for our pets.
Absolutely. Nothing but the best. Thank you so very much. This is not the last you've heard of me. I'm sorry, even if you want it to be. No, I'm kidding.
Yeah, I want you to do before and after pictures on
I'm going.
Dakota.
I am. I got to clean him up a little bit. You know, those nice gray horses that this time of year. He's not gray, he's brown. But yes, I'm going to. And I'm also going to go out to Amazon and purchase all of your books so I can have some fun reading and enlightening reading. And I want to learn horse yoga. I want to learn all of this. I truly do. So I can make his rest of his life absolutely the best possible. Thank you so
Kimberly.
much for being a guest on the Backyard Horse Enthusiast.
Coming soon, Holistic Horseworks Remedies.
Take the guesswork out of your horse's health. What would you do if your horse is limping, colicking, tripping, spooking? Created for horse owners who want to troubleshoot, learn, and take action right from your pocket to your fingertips. This app is designed for the horse person on the go who needs answers fast. Figure out what is really going on with your horse. Find natural remedies that work. Explore expert solutions to common horse health issues.
Holistic Horseworks Remedies. Coming soon to Google Play and the App Store.